Greetings and welcome to Group 11's video this week. My name is Hannah. So Careful Devices is a design-led research project on domestic healthcare technologies that seek to bridge the gap between the lived experience of a person and the abstracted medical knowledge of a health practitioner. The project looks to reframe contemporary understandings of this tech as being part of a practice of health that centers on personal experience and judgment rather than medicalized definitions of sickness or disease. The project operates at the intersection of two major health trends in technology and healthcare: growing interest in gathering health data through consumer technologies, and a shift towards at-home medical practices. This approach builds from current HCI ideas around participatory and critical approaches to home healthcare and self-monitoring, emphasizing the role of design and integrating broader context and personal idiosyncrasies. The researchers believe that critical interaction design in the context of home health devices can strike a balance between medical knowledge and the lived experience of health, and that this can offer a different perspective on the self than would be possible in a purely clinical setting.
Hi, it's Chris. I'm going to be talking about Careful Devices. Careful Devices have bridged the gap between the lived experience of a person and the abstracted medical knowledge of a health practitioner. They've also created devices that are reflective and create opportunities to share information that's usually unavailable. Some considerations are: what kind of data is stored and transmitted? Does this data include private medical information? What is the potential harm if data is erased? What are the risks of connecting or not connecting a device? Some of the strategies are: choose the right type and level of encryption, use appropriate security controls for access to data, ensure good engineering by prioritizing secure design and coding, track cybersecurity risks during product development, limit the amount of data stored, and use the right type and level of encryption. Connected medical devices provide a variety of benefits, including automatic alerts, remote monitoring, early diagnosis, lowered healthcare, and most importantly, improved patient outcome. When properly secured and maintained, these devices can be a very beneficial tool for improving healthcare. In most cases, the benefits outweigh the risks. Thank you.
Hello, my name is Tyson Lee. To start off, All of Us is a modern research project by the National Institute of Health that aims to improve precision medicine. Precision medicine can be defined as a type of healthcare that is personal to the individual, such as basing off the individual's location, health behavior, lifestyle, and family health history. This is important to provide the best type of treatment personal to the patient. In order for this to happen, all of us needs at least 1 million people to share their health information and data for researchers to study over time. Hopefully, this would improve the health of later generations on the community level and the individual level.
Hi, my name is Dallas Figueroa, and I'll be talking about the pros and cons of All of Us. All of Us is a research program that is promising for various reasons. It is seeking to improve healthcare for individuals and make more personal treatment plans by getting to know several factors of one's lifestyle. Not only will this make patients feel like they're being well taken care of, it can also help improve rates of other epidemics like heart disease and diabetes, because we are now paying attention to other factors like where does one reside in and what they do for a living. However, some concerns are that they have all this information in an electronic biobank, thus possibly running the risk for someone hacking into their system and getting information.
Hi everyone, it's Jasmine. So you might be wondering, how can you get involved with All of Us? I was wondering why the All of Us logo looked so familiar to me, and then I realized I walk by their office nearly every day on my way to research. They guided me to their website for more information. To get started, you need to create an account, fill out enrollment forms and consent forms, and then complete different surveys and go to different appointments if need be. If you want more details, click Learn More, and they guide you through each of the steps even more, talking about how you need to share your EHR, fill out different surveys, and possibly visit a partner center. Then, if you're wondering if you're eligible, you can click the Who Can Join button and find out that enrollment's open to all eligible adults who live in the United States, people of every race, ethnicity, sex, gender, and sexual orientation. You don't need health insurance as they're not providing you any sort of health service. And you don't even need to speak English. They have Spanish-speaking advisors, and they're looking to expand to many other languages as well. If you're really committed to joining this project, you can visit UCI's All of Us webpage, and the primary investigator is Dr. Anton Culver. Their website is basically a condensed version of the All of Us website, and you can find out that you can get $25 compensation for being part of the study. The two closest locations to campus are the UCI Gavin Herbert Eye Institute and the Goats Chalk Plaza. Both are within walking distance of campus. Thank you all for a great quarter, and we wish you luck in your future endeavors.